Hey, thank you very much. Thank you for letting me kick off today. It's a real pleasure to be here to talk to you, and I think I should be working with all the other speakers here today. It sounds fascinating, so looking forward to talking with everybody. As introduced, I work at the University of York, and I'm going to present today a study that I did as part of my PhD thesis, which ended a couple of years ago, looking at the role of ecological quality of the natural environment for subjective wellbeing. Okay, so there's a big body of evidence that's growing that looks at how exposure and spending time outside in nature is good for our well-being. So when I want to look for good headlines for this, I go to my favourite place, the Daily Mail, and I found this lovely article from the end of the year which summarises lots of studies that look at how spending time outdoors in the natural environment brings about many varied health benefits. So here there's you can see lots of health benefits in the heading there. There's also an economic benefit to spending time and being exposed to the outdoors in terms of economic costs, in terms of healthcare savings. And there's an article here about that from a different place. And then also this relationship was absolutely magnified during lockdown and through COVID-19, where people started to use their neighbourhood green and blue spaces much more. So this understanding that proximity and exposure to the natural environment and the health benefits that it brings has kind of infiltrated into all levels of policy and practice, from local to international. So I've got a couple of examples here. The image on the left is David Cameron's measures of national wellbeing from 2010. He started this. So the green ones at the bottom are to do with the natural environment. And on the right is the Sustainable Development Goals, and I've just highlighted one of them. Number 3 is about good health and wellbeing for all, and these are really embedded in all the environmental goals as part of the SDGs. So, homing in, I study London as a case study. So why is London interesting to look at? And probably generally large urban areas in particular. So looking at London, we know that Londoners have lower subjective wellbeing than our national average. We also know that the incidence of poor mental health in Londoners is prevalent. And there's this horrible statistic about child mental health in London as well. So it's an interesting place to study. Now looking at the natural environment in London, so we know that it has a dense population. Much of the country's population lives in London. We also know that the provision per person of green space is lower than the national average. And we also know that the green and blue spaces in London are important in terms of healthcare costs. So we have a big population with a low provision of green space, with lower wellbeing and high mental health issues in the city. So it's a really important place to study this relationship. So I've got this nice image here from one of the What Works Wellbeing reports that was written a couple of years ago, summarising evidence that looks at the determinants of subjective wellbeing. And so you can see here's a real mix of types of things that impact wellbeing. So you can see things like education, labour force status, health. You can see here in the middle, there's green space slightly to the right, which shows that green space has a positive relationship with wellbeing. So knowing this, why are we researching it? So there are so many gaps in our understanding and the way that this relationship is studied. So I've picked out a few here that I begin to address it in my work. So overall, there's a positive relationship between wellbeing and the natural environment, but a big gap that needs addressing in this area is looking at the different characteristics and types and qualities of these green spaces and blue spaces. They're not all homogeneous, they're not all equal. So what is it specifically about these spaces that relates to people? I think myself and Maria are both going to touch on this. So I specifically look at biodiversity and the ecological quality of these sites. Another aspect of this body of work is that most studies are cross-sectional in nature. So they draw associations and relationships between people and nature. But there's still a lack of being able to tease out, do people live in biodiverse environments and therefore have higher well-being? Or is it that people with higher well-being move to more biodiverse areas? So teasing out causality is still a big thing here. Methodologically, many studies use aggregated statistics. So lots of studies are done at boundary neighbourhood areas, so things like low super output areas, buffer zones and things like that, which can sometimes suffer from exposure misclassification. Similarly, often Euclidean distances are used as the crow flies, which can sometimes miss issues around actual walking routes, actual ways that people would get to places. And similarly, they can ignore actual access. So it might be that the entrance to one of these sites is really, really far away. So actually the distance to get there is more. Or it might be that there's a railway line just in between where you live and this place. So the access is actually much lower. Similarly, the difference between publicly accessible, semi-publicly accessible, for example, courses and private access is also different. And more broadly, in this, some studies can lack control variables. If you think back to that previous slide about all the different determinants of well-being, it's really important to be able to control for lots of those when trying to isolate the relationship between well-being and the natural environment. So lots to chew on, lots of work to do. So what did I do? So I used the British Household Panel Survey, the BHPS, waves 1 to 18, and that spans from 91 till 2008. I used all adults that live, have a residential address in London. So this whittles it down to about 1,600 adults. And so some adults have 18 waves to them. And I think the average in my sample is about 5 to 6 waves per person. And I do all this in the UK Data Service Secure Lab environment. So I used a really nice postcode level spatial resolution for the people. And then the other nice thing about working in London is that there's really nice green and blue space data. So we get our data from the Green Space Information for Greater London organisation, GIGGLE. They're the kind of biological record centre for London. So all the different boroughs and councils collect the data and they submit it all to GIGGLE, who hold it centrally. So for my measures of the natural environment, I'm using 2 site categories: sites of importance for nature conservation, sinks, and public open spaces. And I'll talk about those in a second. So GIGGLE also, as well as holding the location of these places, they also conduct deficiency mapping. So they use a very complicated and neat network layer underneath these sites with known routes on roads, paths, ferries, bridges, all these kinds of things that people can walk across, and known entry points to sites, and use that as a network layer underneath to conduct network analysis from sites across the region to identify areas that are beyond a certain walking distance from these sites. And I'll talk about that in a sec. So sinks, sites of importance for nature conservation. So these are sites that have been identified by boroughs as having habitat that's important for wildlife. So this is a London specific designation. It sits kind of within all the statutory designations as well, such as Ramsar sites and Saxon SSIs and things. So local councils are responsible for identifying these and identifying places that are deficient in access to them. Under the London Plan and the Greater London Authority and the Mayor of London, the local councils are required to do something about areas that are deficient in access. So these areas of deficiency in access, these are calculated by using that complicated network underneath the locations of the sites to identify places that are beyond 1 kilometre walk from known entry points along known roads and paths from these sites. So what does that look like? Here you go. So the orange are the sinks and the grey areas are the areas that have been modelled to be deficient to nature. So this work looks at basically asking the question, do people that live in the grey areas have a different level of well-being to those that live outside of the grey areas? doing something very similar as a comparison with public open spaces. The public open spaces are publicly accessible green and blue spaces, regardless of their environmental and ecological quality. So doing the same thing, you've got the 4 different categories of public open space here: local, district, metropolitan and regional. So they all differ in their size and their facilities and function. And then Giggle have modelled different areas of deficiency to these public open spaces. So I want to ask, do you see the same relationship with the public open spaces as you do with sinks? Or is the ecological quality an important factor when looking at the relationship with wellbeing? So let's have a look. So I used 2 measures of wellbeing from the BHPS, life satisfaction and the general health questionnaire. I use lots of the covariate data that's in the BHPS, and I also bring in some neighbourhood level measures such as deprivation and air pollution, and then I use fixed effects regression to try and bring out some of that bias in there for between individual differences. So what did I find? So this is still under review, so let's keep this graph amongst ourselves for now. So our key findings were, if we look at the column on the left, we can see that that's deficiency to sinks. So living in an area that's deficient to nature is bad for life satisfaction. So our y-axis here is the standardised coefficients from the regression model. So being deficient to nature is bad for life satisfaction. We didn't see the same relationship with the GHQ. So there's no relationship between mental distress and being deficient to nature, which was interesting. We also didn't find any relationship between either wellbeing measure and any of the public open space categories, suggestive that it's ecological quality that's particularly important for wellbeing in London. So using standardised coefficients, we can then compare the effect size with other determinants of wellbeing. We see things here that we'd expect. So having a health condition and being unemployed are bad for wellbeing on both measures. Being in a relationship is good for life satisfaction. And we note that the effect sizes are all comparable. And particularly here, interesting for me, from an environmental background, is that access to private open space is beneficial for both measures of wellbeing, and the effect size is similar to the negative effect of being deficient to nature. So that's something that we're interested in going forward. So why might this be? What's going on? So it might be that it's the biodiversity in these areas. If the relationship is found there with places that are considered important for biodiversity, is it the biodiversity that's there? Are these places, do they have psychological and physiological restoration? Are they good for people to spend time in? Do they offer places for soft distraction and therefore kind of restorative for the mind, as opposed to hard distraction like buildings and cars, etc., traffic? It might be that in an urban area, actually the opportunities to engage with wildlife are rare. So these places are seen as kind of special and different and kind of exciting to be in there. They might be aesthetically pleasing and might have this kind of invoke fascination and inspiration in people that are looking for these different experiences in an urban area. Or it might be more nuanced, and it might be that knowing that you live in an area that looks good and has good open spaces improves your satisfaction with your neighbourhood, and therefore your life satisfaction is higher. So that can be measured and explored further. But certainly this research supports other findings. It shows that nature exposure has a stronger effect on positive effect rather than just with negative effect, and that might explain why we see the difference between life satisfaction and mental distress. So the implications for this work as well. So it demonstrates that sinks is an important part of the urban green infrastructure in London. And sinks support all of the priority species in the biodiversity action plans in the UK for London, and about 91% of all species in London together. So they're an important place for wildlife. And also there's real opportunities for co-benefits here. For developing and supporting sinks has benefits for wildlife and also for people's health and well-being. So designation is actually a really meaningful mechanism for policy and practice and intervention, as opposed to measuring a particular type of biodiversity, for example, bird species richness or so forth. It has more meaning when it comes to intervention. So the mechanisms in London, for example, will be planning, funding and engaging people with the environment. So limitations to this work, you can see that there are certain, the distances that were chosen for proximity between residential location and spaces differ across the different categories of site. And it might be that, so in the UK, there's no actually in the UK and actually across all places in the world, there's no consensus about what the distance should be between where you live and where a green or blue site should be. So it would be interesting to play with these distances to see if you get different relationships with different green and blue spaces and different qualities of green and blue space. In the sinks and the POS categories, they don't differentiate between green and blue space, and research shows that wellbeing relationships with blue spaces differ to green space, so it'll be interesting to tease them out. And work that I'm doing at the moment in my fellowship delves into this a bit more to look at the role of inequalities in access to good quality spaces, and also the role of psychological connection to nature, how we think and connect with data individually and as a community and culturally. So, for example, there are known inequalities in access and in provision of green and blue spaces, and also in access and provision to good quality green spaces, looking at just several measures of different demographics, for example. And also this differs spatially as well. And then also nature connectedness. So people who are more connected to nature have more positive health outcomes, and they also present pro-environmental behaviours. So there's a real opportunity here, I think, for kind of cost-effective interventions for environmental and health co-benefits if we can somehow leverage nature connectedness within the population. And this is on the government's agenda for sure. So summary. Ecological quality is important for the well-being of residents in London, dependent on the well-being measure that you're looking at. There are opportunities here to maintain and improve the sink network in London. So improve existing spaces, create new ones, improve access to what's there already, in a real opportunity for cost-effective co-benefits. I would just personally like to say measuring exposure and proximity to the natural environment is hard, and I think there's real interest in building more robust measures to do this, and I'm sure Marie will say exactly the same thing. And future work is really important to understand inequalities in access to good green and blue spaces, and somehow kind of tease out the complexity between health, inequalities, biodiversity and nature connectedness, ultimately to reduce the health burden brought on by inequalities in our society. And I'll finish there to say thank you to my co-authors, collaborators and funders. Thank you very much, everyone.